Hi everyone, my name is Faro and I did my final project on data mining techniques for detecting incorrect claim reimbursements. The COVID-19 pandemic forced health insurance companies to create many new policies, and because those policies were new and a little bit unclear, it resulted in confusion, which ultimately led to billing mistakes and reimbursement mistakes. I will be auditing claims from DC Medicaid. And on the slide, I have a list of some attributes that I want included in my final data set. For the data pre-processing phase, I was ready to create a report within our agency's reporting tool, and the report was designed to obtain my initial data set. Here's the design of the report I created to obtain the data, and in the bottom you can see that I pre-processed a little bit just to filter some things out. Here's the first part of my code where I began pre-processing my data. And as you can see, I actually imported two different data sets, and I did that because I needed CPT codes and payments, but unfortunately the CPT table in Access, where I just showed you, it doesn't connect well with the payments table. It just results in a lot of duplicates and it gets very confusing pretty fast. So that's why you see two data sets. And then going down, I converted the service date into date time because I couldn't compare the dates without doing that. And then I categorized the primary insurance on the claims into either Alliance or MCO. Then I had to split them up, so then I joined them back together. Then I rearranged the columns just for, I guess, probably aesthetic purposes, because I like to be particular about how the columns are aligned. And then finally I just dropped the duplicates. There were actually 300 duplicates, if I remember correctly, in the data set. Here I did a side analysis where, based on the date of service and the CPT code, I mapped it to the correct reimbursement rate. And then towards the bottom, that's where the input variable is. So in my case, it is the attribute called paid, and that's basically what determines if the claim is paid correctly or paid incorrectly. Here there's a couple more data pre-processing steps that I took, but most importantly, there's an expression for obtaining the output variables, which are coded as binary classifications, either correct payment or incorrect payment. I did some dropping of columns, and also in the very last line, I exported the file into a CSV format so that I can grab from my computer from the appropriate folder to be able to place in Weka for the machine learning analysis at the end. For this analysis, I'll use a supervised learning technique. Supervised learning is a machine learning model where an algorithm is trained on input data. So the data must have already been labeled, and mine is, it's labeled either as correct payment or incorrect payment. In this step, I imported the data into Weka, and the first thing I did was I dropped the independent variable attribute and then converted all of the attributes from numeric to nominal. I was able to run the naive Bayes, the decision trees, and the random forest classification models, and it looks like the classification model of random forest yielded the best results out of those three because it had the least incorrectly classified instances and better rates of precision, recall, and area under the curve. Unfortunately, there are not that many studies that analyze the financial information derived from healthcare agencies, and I think it's mostly due to the fact that there's a lot of sensitive data within the data. I mean, it's people's personal health information, so it's very hard for study or researchers to be able to get access to such data. But one research that I found that actually did stand out to me, although not in the healthcare field, the article was the closest I could find to the particular topic that I'm covering. And it's called The Use of Data Mining Applied in the Accounts Receivables from the Employees of a Government Institution in Mexico. So the revenue cycle management system within a healthcare agency is basically accounts receivable. So as I read through this article, there were some things that made sense, and I'm kind of surprised to realize that not a lot of study is done on this topic because, at the healthcare field within the United States is very financially driven. So I'm just a little bit surprised. I personally believe that this topic really impacts healthcare a lot, and the use of data mining in financial realm of the healthcare field, it's not established like the clinical aspects, but it is in the works. So what I'm noticing is that payers are making a lot of mistakes, and sometimes the mistakes are making me suspicious as to if this system is designed in a way to fail. I mean, I wouldn't be surprised considering the US runs heavily on healthcare as a business. As I stated before in my topic presentation, up to 10% of healthcare expenditure is wasted on instances such as this. So to catch the payment errors, it will reduce the chance of even sending patients incorrect statements. So I don't know if you've ever experienced it, but I've definitely had a provider send me a statement, but I found out later that it's because the insurance didn't pay correctly. Now I do look into those stuff, but I know that there's many people who don't. They don't really understand insurance, and they just end up kind of paying it. And lastly, analysis like these can help, for example, CFOs make decisions such as if they want to keep a contract with a payer or if they find it worthless to continue doing a service. Maybe my health center will decide that they don't want to perform COVID testing anymore because it's not making them any money. Now, I don't think that will happen, but it could be a case with a different service.